Just hanging out in my kitchen, wearing some scrubs. That's totally normal. Nothing unusual there. Yesterday was a really sad day for the NHS. After his long-term campaign to sabotage negotiations, the Health Secretary moved to impose an unsafe, unfair contract on the junior doctors. A couple of hours later, I got this text from my friend Natalie. I heard that bastard Jeremy Blunt got his way. Angry face, sad face, kiss, kiss, kiss. Later, my friend Anne-Marie on Facebook, mark my words, the nurses will be next. Nail on the head, Anne-Marie. It's been clear from the offing that the government aren't really interested in improving staffing levels throughout the week. If they were, they wouldn't have included deaths on a Friday in their questionable figures about weekend mortality. If they were serious about expanding 7-day services, they'd give us the resources to do it, rather than making us just stretch what we've got even further. All this government is really interested in is picking a fight with the BMA and banking on the other health unions sitting on the sidelines, serving up some mealy-mouthed platitudes about loving the NHS. And to be fair, what resistance did the leaders of our health unions put up to private finance initiative, foundation trust status, the Health and Social Care Act, the real terms pay cuts endured by NHS staff, the privatisation of some entire trusts? Virgin Care, Richard Branson now runs the Sittingbourne Memorial Hospital. And not just them. So I can see, for anybody wanting to completely dismantle and sell off the NHS, a strategy of steamroll the doctors, then come back for the rest might be a pretty safe bet. I got this email yesterday from my union, UNISON. Please fill out this survey about how safe your staffing was on the 9th of February. I mean, heart unions and everything, but mate, we don't need a bloody survey to tell us that we have several thousand men down, just like we were last year. The Doctors' Union are continuing to invite the elusive Jeremy for talks. And if there are further strikes, we need to back them the hell up. Given that our last pay award was 1% over 2 years, I'm sure we can find something to ballot over. The alternative, we carry on doing our surveys, tweeting our selfies, and waiting for the Minister for Privatisation to come for our contracts. If they can impose a contract on the junior doctors, what do you think they'll do to the rest of us on the Agenda for Change agreement? Nurses, physios, radiographers, midwives, porters, ward clerks, phlebotomists, pathologists and occupational therapists. We have a choice. We can't lobby this government into accepting our well-reasoned arguments. Their agenda is fundamentally about breaking up and privatising the health service. Jeremy even wrote a book about it. 91% of people support the junior doctors. There are 6.5 million workers who are members of trade unions in this country. Some of them work in the NHS. All of them are patients, and national demonstration in defence of the NHS would be a really good way to show the breadth and depth of public opposition to the Tory healthcare agenda. This is a weak government that is going for broke, and the only way that we're going to get anything out of them is by using our collective strength. Share, subscribe, see you later.